Hello, everyone. Welcome and thank you for joining this International Women's Day webinar highlighting women in drowning prevention. This is actually the third webinar we've held for International Women's Day. And so it's great to have you all online from across the world. I know it's the morning for some people, the afternoon for others, and very late in the evening. So thank you all for being here with us today. We really appreciate it. My name is Stacey Pigeon. I'm the Research and Policy Manager for Royal Lifesaving Australia, and I will be your host today. Before we start, I would like to acknowledge the First Nations people of Australia, their continuing connection and custodianship of land and waterways, and I acknowledge elders past, present, and emerging, and any First Nations people joining us today from around the world. So just a few housekeeping points for those who have just joined us. We are recording today's webinar and we'll make it available as soon as possible in the next few days for those who can't join us. Today's webinar is going to be consisting of 3 short panel sessions, and then we'll bring everyone together at the end to give their thoughts as well. So today we're going to hear from 6 women from all corners of the world, from research, advocacy, programs, and lifesaving, doing some amazing things to reduce drowning. Some might have heard their stories at the recent World Conference on Drowning Prevention in Perth last year. For others, this will be new, so please enjoy the next hour or so. Our first panel is parent-led advocacy, and I would really like to warmly welcome 2 incredibly inspiring women who have been motivated by their own tragedies to give back and ensure that no child misses out on a swimming and water safety education in their communities. I'd like to invite Chezik, Tsunoda, the filmmaker and founder of No More Under, and a passionate water safety advocate in the name of her son who drowned. She works tirelessly to decrease inequities in drowning among children and increase access to swimming lessons. Our second speaker on this panel is Kirsty Doig, the founder and director of the Darcey Sunshine Foundation, born from the personal loss of her daughter's drowning. Kirsty strives to ensure more children in South Africa can access swimming and water safety education. So thank you both for being here with us today. I'm really looking forward to hearing a little bit more about the work that you do. So Chezik, I'll start with you. Can you tell the audience a little bit more about No More Under?
Sure. First, I want to say thank you for having this and hosting this. I think it's amazing. So No More Under, we're based in Seattle, Washington area, and we're really focused on doing this work through legislation, education, and creating equitable access. So when I kind of started doing research, I recognized the disparities with Black and Brown children, also under-resourced families. And so we really lean into creating free swim lessons and access to those that don't have it or don't even know that they need it, as well as working with our local and state legislators to create laws to get, the awareness and information out.
Thanks, Chezik. You've also produced a film called Drowning in Silence. Can you tell us a little bit about the film and what you wanted to achieve with the project?
Sure. Drowning in Silence is basically my journey after my son passed away, and just kind of the realizations that you have as a parent, it being preventable, and also not being alone. So I traveled the United States speaking with other parents who have had a similar experience, some who've lost children, and others who have nearly drowned or drowned, but, are still alive with some significant brain injury. And also experts, everyone from Dr. Kwan and Tizzy to actually, which the ISR, one of the ISR founders. So really, I'm hoping that the film can be a resource to not only other parents that have had this loss. I think it does touch them, and there's an understanding when you do watch it if you have lost a child, but also lifeguards and pediatricians, and honestly, community members who are supporting families that have lost children. So it's really a resource. And bottom line, I'm hopeful that when people watch, they shift their perspective on water and water safety.
That's amazing. A powerful tool for advocacy as well. But also having that parent support network is very important as well. In your opinion, what's been the biggest success so far that you've achieved through your drowning prevention advocacy work?
You know, you asked this question and it's a tricky one, right? Because sometimes I think just being able to meet people where they're at is the most important, and really getting into the community and talking to families. However, we were able to pass a law last year and are still working with legislators to work on curriculum. You know, in Australia, you all have an amazing setup, and we are working really hard to follow in your footsteps here in the US. And so I really think working with our state legislators and trying to push laws that can really implement and impact is probably one of our greatest achievements.
No, that's great. And certainly legislation is a big one for drowning prevention. And it's great that your work has been able to make that change as well. So amazing. We could spend hours talking to you on your journey, but I'd like to shift to Kirsty, who's doing similar work. And I'd love to hear more about your work, Kirsty, about the Darcey Sunshine Foundation.
Yeah, thanks, Stacey. And again, thanks for giving me the opportunity to be here today with this incredible panel. Yeah, the Darcey Sunshine Foundation was founded in 2020 following the loss of our little girl, Darcey Elizabeth Sunshine. And I have to say, in the midst of my grief, I was surrounded by the most incredible group of women, my dearest friends, who lifted me and found me a way out of the darkness. And it was spreading Darcey Sunshine. So we now partner with preschools from vulnerable communities, and we partner them with local established swim schools. So through doing this, we can offer a full year of water safety education and survival swim skills to the children of that community. Over the years we've grown, we're now able to reach hundreds of children a year through these partnerships, which is amazing. But more than that, we're now starting to reach their parents as well. So we're giving parent education days, we're teaching basic water safety to them, but also basic CPR as well. And really just the importance of having this conversation in these very vulnerable communities that are surrounded by massive open bodies of water. And it being a positive conversation, that drowning isn't something that just happens. It's something that can be prevented with the right education, with the right understanding as well. Yeah, we've also just branched into offering swim teacher qualifications as well. So we've had our first scholarship student, a beautiful young woman from a local community who doesn't only want to help our project, but she also wants to teach the women of her community how to be safer around water and teach them basic swim skills as well, which is lovely.
What a fantastic outcome. And I guess also you talked about parent education as well, which is incredibly important, not just teaching children, but teaching their parents as well, which is fantastic. The foundation spans 2 countries, so I understand, South Africa and Scotland. Are you able to tell us a little bit about the similarities and perhaps the challenges delivering in those 2 countries and communities?
Yeah, I mean, Scotland is new. I just moved back here last year, so we're still very fledgling, still building partnerships. But one of the main things that was covered at the World Drowning Prevention Conference was that we need a global strategy, but it needs to be tailored country by country, community by community, and that's really important. And that, the stark differences between Scotland, where the high incidence of drowning is within males over 40, and it's down to cold water shock, compared to South Africa, where we have, around 800 children that drown every year. And a lot of that's in open water and open fresh water as well. So our strategy is quite different. We're very much targeting children and education, early education in South Africa, and here in Scotland, we're more focused on experiential learning in cold water. You can tell someone to float and relax in cold water, but until you've felt the icy chill and understand what that means. So we're trying to get more children having experiential days and understanding within the cold water here. And yeah, the difference in resources between the communities in South Africa and Scotland are vastly different. However, each of them have their own massive positive and opportunities there too.
Well, that's fantastic that you've been able to do that in both countries. I'd also like to ask you, what do you think's been your biggest success so far with the foundation, or with your drowning prevention advocacy work?
I think for us, it's just that conversation being started in communities where this has just been something that's been accepted, that another person's drowned, another child gone, that they're starting to realise that they can do something about it through education. We give every one of our kids a massive water safety warrior badge. It's almost the same size as their face when they finish each year. And they wear that with pride. And it means that they're going back to their siblings, they're going back to their parents, they're going back to their grannies and grandpas and the shopkeeper in the community. And they're teaching them, you know, call 112 if there's an emergency. They're teaching them not to go near the water unless they've got someone with them. So that's that having that conversation, something that is now discussed. Is going to be is probably the most important thing for me.
That's fantastic. And thank you so much, both. I know it was very short snippets of what you're both doing, incredibly important. And just from your personal experience as well, and sharing just a snippet of your experience. We do have some other speakers with us this evening, so I will bring you both back on screen a little bit later on. But thank you both again for sharing your experiences and what you're doing on the ground in your communities. Thank you so much. I'd like to introduce our next two speakers. We'll be talking a little bit more about community and local programs and roles of gender. So another amazing woman doing some very interesting work in lower middle income countries, increasing awareness of drowning in their communities, and also the role of women in drowning prevention in Bangladesh and Indonesia. I'd like to introduce Nahid Akther, the Communications Manager at the Centre for Injury Prevention in Bangladesh. She's a champion for developing communication strategies for drowning prevention, most recently spearheading a research program to empower female swimming instructors. And Tia Doig is from the University of Mataram, Indonesia, and James Cook University. She's a medical professional committed to preventing drowning through Indonesia and through her research. So welcome, both of you. Nahid, I'll start with you in Bangladesh. I know you're in London at the moment, so thank you for joining us so early in the morning. Can you tell us more about your drowning prevention work in Bangladesh?
Yeah, thank you, Stacey. Thank you for the platform and thank you for inviting me in this webinar, So I have joined in my organization for who I'm working now, that is a Center for Injury Prevention and Research Bangladesh. It's a research organization, and it was started its journey in 2005. And the motto was only to prevent drowning in Bangladesh. So I am now working in various projects which are running in various districts in Bangladesh. So currently we have four, drowning prevention intervention. First one, we have around 600 community-based, community-based taking care service, that is Achal, Gracious. Second one, that is to teach swimming to the 6 to 10 years old children. And the third one is to train the community people how to give CPR after removing anyone from drowning. And the fourth one, the lifeguard service in the Cox's Bazar, that is one of the largest sea beaches in the world. So we have 4 services now, and recently I have started a research, that is, I have said, that is, we have intervention to teach swim to the community, to the 6 to 10 years old children. The death rate is very high in this particular age. So the most swimming instructors, female swimming instructors, are female. So um, they have a barrier to go into water in their period. So I have started a research on them, how to reduce their non-working days. And we are piloting a project introducing menstrual cup, and that is on progress. So the another one to give CPR, that is, we have a champion, that is, her name is Shamsun, who have already given training to 19,000 people in Bangladesh how to give CPR. So she is now our, that is the champion, and she is doing amazing job in the community. And she is now trained, and she is now ongoing to train more people, to let them know how to do CPR, how to receive anyone, and not only that, for not only CPR, so that the basic life-saving training is also he is one of our training modules. So and I'll talk a little about our crashes. So we have said 600 crashes in our community, in the rural community. So we choose a house in the community and choose a crash mother, and she is trained about how to take care of the children of below 5 year old, and how to develop their reading capability, to communicate with each other, that is early childhood development. So we give her training, and she donate one of the room of his house, and she is responsible to take care to 20 to 25 children from 9 a.m. to 1 p.m. That is the most vulnerable time of drowning. So she takes care of those children in their house. And recently, and they are also capable to do CPR as well. So some of the crash mother is our champion. That is, they not only are not taking care of those children, but also they are very known in their community. If anybody drown and he or she saved, then immediately the community people call her to give CPR, or what is the next step to save the life. So we are doing this job. And then fourth number is that is the lifeguard service. It's based on Cox's Bazar, and we have 27 lifeguards in our coastal area, in the Cox's Bazar beach area, and they are doing a wonderful job.
Fantastic. Some great initiatives going on at the community level in Bangladesh. And you've talked about the role of women in drowning prevention, and that sounds incredibly practical, and that they're preventing drowning, particularly among young children. You did touch on this in what you were talking about, but are you able to, I guess, outline some of the barriers for women in becoming swim instructors and getting more involved in drowning prevention roles?
Yeah, I can. So when we have started the swimming teaching to the young children of our community, so first we have started at 2015 or 16. So we assumed that is the most community swimming instructor would be male, because male are very strong. They are very capable to handle children who are naughty. But in the first station, first phase of our project, the project name is Bhasha, that is a float in English. So after the first phase, we have found that is the female community instructor are more acceptable in the community, because most of the children, half of the children are female, are the girl. So for those girls to learn swim from a male instructor is have some barriers. So in the second phase, we found that is 82% or 85% community swimming instructors are female. So we have to train them, we have to employ them, we have to engage them to teaching the swimming. But after one season, we have found that is in the particular day in a month, that is during their period, they have to stay away from the water, like 4 or 5 days they can go into the water. There is some cultural and social taboo, that is she can't go into water during their period. So I have found that that barrier in one of our report, that is they are missing, and our targeting was very tight. They are not capable to fulfill their target. So every year our target is we have to teach swimming to around 10,000 children of that community. So the target was very tight. So we have thought that is we should take some initiative to learn them how to teach them, so that they can avoid the non-working days. So I found some literature based on Australia and USA, that is they are using menstrual cup and they can go easily into the water by using the menstrual cup. So we have taken the initiative, and last season in 2023, in that season we have trained the community swimming instructor how to use it, and we have donated the cup. And finally, after end of the season, we found that is 93% of the CSIs, female CSIs, are perfectly doing their job. They didn't miss any of their working day due to period. This is one of the reason. And another is there are socio-cultural taboo, that is for being a community swimming instructor. That is, in rural Bangladesh, if you go into the water, your body will wet. So we have to set a particular area. We have to select a particular pond that is safe for the female instructor, and we have to set a changing room beside the pond so that they can change, or the girl child can change their wet dress in that room. So we are struggling a lot, and we are achieving some of our targets. Yeah.
That's really interesting. I think for some people or some of our audience, maybe it's an issue that, well, not an issue for others, and some that maybe hasn't been thought about in terms of drowning prevention and the impact that it has in terms of swimming instructors and things. So it sounds like you're very much trying to solve that problem and provide support to your female instructors to make sure they don't miss any days of employment for them and impacting swimming lessons for children. So some really interesting work going on ahead, and I applaud you and your team for taking that initiative. So thank you. I'll bring on screen Tia, who comes from a bit of a different lens in terms of a research perspective in Indonesia. Tia, can you tell us a little bit about your work in terms of drowning prevention in Indonesia?
Yes, Stacey, thank you for having me all the way from Indonesia. So I'm a GP, a lecturer, and a researcher based in Lombok, Indonesia. For those who haven't heard of Lombok, it's a teeny tiny island next to Bali, which I'm sure is quite familiar with the Australian audience. So I've been working in investigating unintentional drowning, fatal and non-fatal, in low and middle-income countries, particularly in Indonesia, since 2016, and now I'm undertaking a PhD project in James Cook University exploring mortality rates, incident rates, burden of disease, risk factors, and prevention interventions of unintentional drowning in 38 provinces of Indonesia, looking at the interconnection of these aspects and the socio-ecological approaches of health promotion.
Thanks, Tia. In terms of drowning in Indonesia is, I guess it's not something that we've really heard a lot of. I know there's a gap in the research and hence why you're looking at it. In terms of males and females, is there much difference in drowning rates or drowning within males and females in Indonesia?
The pattern of drowning in Indonesia based on sex pretty much correspond to the finding in other countries. So males in Indonesia were 1.8 times more likely than females to unintentionally drown, with the highest mortality rates consistently observed among the under 5 male populations. However, the pattern is a little bit different in the most rural provinces of Indonesia, such as provinces in Papua, where the gap between the male mortality rates and female mortality rates, especially for the under 5 population, is not as wide as in provinces in a more developed areas in central or in western part of Indonesia. I think what also interesting regarding male and female drowning in Indonesia is the underlying link between unintentional drowning in Indonesia and water transport safety regulation. And Indonesia is the largest archipelagic state in the world with over 17,000 islands. So water transportation plays a very important role in commuting goods and peoples across different islands. And also the link between unintentional drowning and occupational safety and health and rural development and public policy instruments that actually governs the provision of infrastructure of care to support the ability of women to provide supervision for their children at home.
Well, that's really interesting. I think when you talk about water transportation as well, and then the role of women as well in that. In terms of your research, what would you like to see, I guess, progress as a result of your research, or what would you like to see your research impact on going forward in drowning prevention in Indonesia?
Yeah, so I think it actually relates to the theme of today's event, which is inclusivity. I think it is very important, and I hope to see the exploration of the development, implementation, and evaluation of contextualized, tailored drowning prevention program with careful consideration of local community perception on perceived susceptibility, perceived severity of the issue of child drowning, along with perceived benefits, barrier, and self-efficacy in taking action in reducing the risk of child drowning in the local community, including barriers and self-efficacy related to gender roles for child care and male and female equality.
And that's certainly a current theme. I think we've already heard from Kirsty and Chezik and Nahid as well in terms of those localized community prevention initiatives on the ground and tailoring it to the context of each community, which we've already heard can be quite different from South Africa to Scotland to the United States and to Bangladesh as well. And you're talking about localized efforts in Indonesia. So it sounds like you're doing some wonderful research that will certainly fill the gap in terms of drowning prevention knowledge in Indonesia. And I really look forward to seeing more about your research and how that impacts drowning prevention strategies in Indonesia. Thank you, Tia.
Thank you, Stacey.
And thank you, Nahid. We'll bring them both back at the end with our other speakers. This leads us on to our third panel for this evening, this afternoon or this morning, depending on where you are, of course. So I would like to welcome Mariko Roots. She's a lecturer at Loyola Marymount University. She's developed and led international initiatives to reduce drowning disparities and increasing aquatic sport participation among Black, Indigenous, people of colour and other communities in the United States. And then Pamela Simon is the Learning and Development Manager at Surf Lifesaving Australia, responsible for education products and services across all portfolios, including life-saving, sport, member development, and youth. Taking a diversity and inclusion and volunteer recognition and retention. Pamela also is a member of the ILS Rescue Commission Education Committee. So welcome both Mariko and Pamela. Mariko, I'll start with you. Can you tell us about your experience as a collegiate water polo player?
Yes, absolutely. So hello, everyone. My name is Mariko, and I think my water polo career was a great example of both what water polo and other aquatic sports can be, and also how far we are from getting to an ideal vision of what diversity, equity, and inclusion can look like in this space. I started playing water polo when I was about 12 or 13. My mom signed me up for a summer program, and I really didn't want to do it. But she was like, no, it's only 6 weeks. And it turned out she'd accidentally signed me up for my high school team. So I was actually locked into something that was more along the lines of 4 years. And even though it was really difficult when I started, I really loved the environment that was created. I was really fortunate to go to what was at the time of my graduation, the 4th most diverse high school in the United States. And while that wasn't always reflected in every high achieving space, it was reflected on the water polo team. And I had a really wonderful and affirming time, both improving my swim and gameplay and teamwork skills, and also in building meaningful connections with diverse women and non-binary folks from across many different communities in LA. And I found that really inspiring and encouraging. And so when I went to college, though, I found that the statistics of my team, wonderful folks though they were, much more match the statistics we see across the board in competitive and high performance aquatic sports throughout the United States and globally. And that was a lot of folks who didn't look like me or come from similar backgrounds. And so because of that, I was really motivated and interested in thinking through how we can make some changes in that regard, because aquatic sports and all sports are such great ways of teaching life skills, of building networks, of learning how to be leaders in your community. Making sure that everyone has equal access to that is really important to me.
Yes, no, definitely. I think certainly across the globe, there is maybe not enough representation in some sports, not all. And I know there's lots of people, yourself and others, working to change that. And there's been some really great progress in that area as well. And I know that's led you to working with some water polo clubs, both at a local and a national level, in terms of trying to increase that diversity, but also increase opportunities for youth from different backgrounds as well. So you're able to tell us a little bit about those programs?
Absolutely. So in the early summer of 2020, when America was going through a very large racial reckoning after the murders of George Floyd, Breonna Taylor, Tony McDade, and many, many other folks at the hands of police officers in our country, there was a discussion that was started, I would say nationwide, but especially within specific predominantly white spaces that included both the university I was attending at the time and my specific team, based on sort of what we've just been talking about. And in response to sort of some of the educational gaps that we were seeing in understanding systemically why there is inequitable access to aquatic sports specifically for communities of color and low-income communities, which is a longer history of sort of structural racism in the US. My teammates and I put together actually an Instagram post, a set of 10 slides that broke down this history and how it impacts our sport and aquatics industries at large, to sort of spread the word. And we contacted sort of every BIPOC Olympian or national team member that we knew, and we started to see really excellent traction within the community about sort of these issues. And so that was when USA Water Polo reached out to me directly and said, we're developing a task force focused on racial equity and reform. Would you be interested in joining and leading our research division in terms of both providing evidence-backed sort of explanations for what we're seeing in our sport right now, and also evidence-backed interventions to reduce some of these health disparities, or reduce some of these participation disparities that we're seeing across the board? And I said yes. And so I spent about 2.5 years working with USA Water Polo, first in this sort of role on the task force, and then officially as a sort of DEI specialist, to develop community partnerships across the United States with organizations and predominantly sort of community groups that were looking to expand aquatics access for these target populations. And so I had the pleasure of executive directing what you see on screen right now, which was our pilot program in New Haven that worked with a local summer enrichment organization to add aquatics into their curriculum. And that evidence and sort of that development of that particular program allowed us to create a grant model that's now being used across the country to support increasing water polo for communities in the United States. And so a lot of that model focuses on community strengths as opposed to sort of community weaknesses or needs, and really focuses on utilizing existing resource networks and community trust and community building infrastructure to extend aquatic teaching and to extend aquatics opportunities for mostly youth, but also adults who don't often have those opportunities. And that is sort of what I've been up to for the past couple of years.
No, that's great. And I think I really like the way you talked about the holistic benefits and the outcomes as well, and not, I guess, doesn't directly link to drowning prevention as such, but certainly water safety, but increasing opportunities to participation is a huge one within our sector to enable everyone to enjoy the water safely. You've already kind of touched on this in terms of my last question for you, but what do you think, or why are these programs needed, and what are the benefits of them? And as I said, you've already sort of touched on that a little bit. So is there anything else you'd like to add to that?
Absolutely. So I think that when we talk about engaging with communities that don't necessarily have a lot of familiarity with water because they've been denied access to water and to water safety for hundreds of years at this point, being able to put what might be a very new environment into a more familiar or comfortable programming model can make a huge difference in overcoming intergenerational fear of and lack of access to water. So I found it really rewarding to be able to use a sport model specifically to get kids in the water who already maybe played basketball or baseball or football and say, hey, here's another sport that you can play. It's equally as fun. It's equally as engaging. It has all of the same rules almost to the sports that you already play, but this one will save your life. Not that basketball and baseball and other sports aren't great, right? But that is one of the greatest strengths, I think, of aquatics, is that we are the only sport that's also a life-saving skill in a very direct and clear way that's needed in these communities. So I think that really pushing that importance is not only great for the branding and for the encouragement of participation in aquatic sports, but most importantly for those who participate in them in terms of, the health benefits that it has and the direct links to drowning prevention that are very clearly present in providing these opportunities.
Definitely. Thank you, Mariko. I think that's, some really interesting work being done there, and certainly increasing opportunities for young people and adults. This brings us to our last panelist for today, Pamela Simon. Welcome, Pamela. Pamela's going to talk to us a little bit about the women's leadership programs at Surf Life Saving Australia, being one of the key drivers. So are you able to tell us a little bit more about those programs, Pamela?
Sure, Stacey, and thanks so much for inviting me along to be a part of this. It's great to be in such good company. So the main program that I'll talk about is our National Women's Mentoring Program, because that's probably the most topical one. So we're currently in our 5th cohort of that. And we, SLSA, or Surf Life Saving Australia, we embrace the importance of a diverse and an inclusive organisation, and that includes gender equality. And we've always been looking to increase the number of women who hold leadership positions within Surf Life Saving nationally. And the Women's Mentoring Programme, what it aims to do is to support and encourage our confident and our strong and skilled women within the movement to strengthen those leadership skills, which they may already have or they may not have, to be able to identify those and to develop really that next generation of leaders to be able to position us for the future of the movement. So the program supports our 2025 strategic plan and our mission, of course, which is to save lives, create great Australians, and build better communities. And that develops more capable and more gender diverse leadership pipeline so that our organization better reflects not just the demographics of Australia, which is 50% of Australia identifies as female, but of our movement, and we have just over 45% of our movement identifying as female. So we first launched the mentoring program in 2020 as part of our celebrations to recognize our 40-year milestone of females being allowed to complete their bronze medallion in the movement. And that was on the 1st of July 2020, and we kicked off with 20 mentors and 20 mentees, and smack bang in the middle of COVID. So it actually worked out quite well because no one needed to get together. We did everything online and we did everything virtually. So it really proved to us that the program was going to be a success regardless of pandemics or anything that wanted to try and kill us any other way. And we now have had over 200 mentors and mentees go through that program, which is fantastic. So initially we limited to over 18s, but we had loads of interest from our younger members. So we now have it from the ages of 16 plus are able to join, and that's been a great success. So we've continued to do that since. So yeah, it's a great program.
Yeah, it sounds like a great initiative. Can you tell us a little bit more about the benefits, I guess, both for the mentees and the mentors?
Yeah, sure. It was, I mean, we recognized that there was a more deliberate focus that was needed to be able to support the identification and the development of our emerging leaders within surf lifesaving. We've always run development programs, our masterclass program and our National Leadership College, which was for emerging leaders, but we just needed something which was more specific to make sure that there was visibility and support of women who were ready for these leadership positions so that they were able to fully utilize their potential to make that difference to the organization. So whenever the program first commenced, we had 20% female representation in management positions at a club level, which is really very low. This has now risen to 30% in the 3 years of the program, which is fantastic. So the percentage of club female presidents has also risen by 10% over that time, which is really good. It's still only sitting at 23%, so we do have a long way to go. But I quite like to joke that it's because our female members in the movement are smart enough to know that that's a silly position to take up, and they're quite happy to leave it to the men to do that role because they know how much work is involved in that. The program promotes women within surf lifesaving, so it facilitates empowerment. It's about supporting each other. It's about the leadership skills, and they can apply it to their paid roles as well, inside and outside of surf lifesaving. So it's not just about volunteer activities; it's about their everyday life. The program promotes their ongoing supportive pathway. So a lot of the time, whenever we get their applications, it's about their personal and their professional development as well. It helps them with networking opportunities. A lot of the time, these people just don't know who it is that they should be turning to assist them in finding out information, or who it is that can help them to take that next step or to hold the ladder for them, if we want to use that analogy. So we really select each mentee, and then that mentee, we then match them with a mentor. And it's based on their demonstrated leadership ability and their potential and their willingness to be able to develop further in that particular area. What we've also found, but is that there's benefits for both the mentee and the mentor. So it's not just a relationship for the mentee. The mentor, we find too, has massive benefits as a result of that partnership. They have an opportunity to be a part of a legacy. They get to give back to the organization and pass on their personal and their professional learnings. And that increases their self-worth as well and makes them feel so much better about themselves. And it enhances their interpersonal skills and increases their network. And we quite often find it re-energizes their engagement with surf lifesaving too. For the mentee, it really builds their confidence. That's what we find a lot of people are wishing to build as a part of the program. It helps their capability with understanding the system, which a lot of the time is what they need to be able to navigate, and it supports them to be able to take control of their own journey, and gives them the opportunity to learn their skills and their behaviors and enhance that network, of course. We run it with the support of a McCarthy Mentoring, who provide an e-learning platform for us, and that is fantastic. And that works them through with a program each month, which allows them to be able to support with those meetings with their between the mentor and the mentee. And that's really it. We really leave it up to the mentee and the mentor to build on that relationship and to pass on their learnings as they go and get out of it whatever it is they put into it, really.
Thanks, Pamela. I can hear how passionate you are about the mentoring program, which is fantastic. And it just sounds like wonderful for both the mentor and the mentee to be involved. Lastly, for you, what advice would you give to other organizations or people wanting to implement something similar for their female members or employees? I know you've already outlined some of the benefits, but do you have any sort of words of wisdom or advice?
Yeah, I mean, as you said, like I'm so passionate about it. It fills our hearts with joy. Anyone who's a staff member or a volunteer that's involved with it, it just gives us so much joy to be part of it. The success stories that we hear from them, from the mentees and the mentors, is just amazing. And we come off our meetings and we come off our workshops, and it's just like we have tears in our eyes and we're just grinning from ear to ear. And it doesn't matter how big or how small that story is, it's the fact that we have enabled them to be able to achieve it. Many of the mentees will go on to become mentors in the program, which is amazing. It's a wonderful testament to their growth personally, but it doesn't cost much to set these programs up. We were able to launch it during COVID, as I said, and no one physically met for 18 months. We still have many of our people who don't meet at all. We on purpose generally will match people who are in 2 different states. And if you know the size of Australia, you'll realize how physically impossible it is quite often to meet. So they do everything virtually. We're very grateful that we have 2 of our members who sponsor the program, both financially and also give us their expertise to assist us with managing that and their intellectual experience with that. And without them, we would never have got it off the ground. And we're very thankful to them for that. But really, we can and we could run this on the smell of an oily rag if we needed to. We have our e-learning program, which is done through a sponsorship with McCarthy Mentoring, which is fantastic. And we're able to bring everyone together at our Aussie Championships for a physical meet. But really, there's no need to ever bring everyone together or to have anything physical. So the option to do it at a very low cost is certainly something that can be done, and we have had many of our clubs replicate the program that we're running at that local level where they have felt that there has been a need, and they have done so at a very cheap cost. So don't feel that a financial input is a requirement, because it certainly isn't, and neither is meeting physically.
Thanks, Pamela. And certainly the resources, I know, is an issue across drowning prevention, across all programs and water safety. But as you said, that these programs can be done on very low resource as well. And certainly coming back to everyone else who's mentioned it around that local contextualization as well at that local level. So really great initiative. And I look forward to hearing more about that later on. What I'm going to do is to bring all of our panelists back on screen for a last very rapid fire couple of questions. Some amazing work going on across the world And I'm so sorry that we didn't have more time to hear more about each and every one of your stories and the wonderful work you're going on, that you're doing, sorry. Got 2 questions, very rapid fire. Firstly, what does inclusion mean to you in the context of drowning prevention? And in an ideal world, what would you like to see in relation to inclusion of women and girls? So obviously those 2 questions do kind of link together, but I might go back to our very first panelists. Chezik, I'll kick off with you for this last little bit.
All right. Happy to start the round. I would just say inclusion to me is making sure that not everyone looks like you in the room. You know, I think I said it earlier, meeting folks where they're at and understanding what the barriers are for everyone, right? Truly and really. I think it's interesting as we talk about, you know, during International Women's Day, as far as girls and getting them more involved. And for me, I think, and it's maybe more of a personal thing, I think it's really leaning into body imaging and making sure that people are comfortable and creating safe spaces for our girls to swim and recreate.
Thank you very much, Chezik. We'll go to you, Kirsty.
Yeah, I concur with Chezik, but I think also inclusion to me means that everyone is given the opportunity to learn how to engage safely with water, not just those that can afford it privately. Everyone and anyone, you know, this is a basic human right to be able to learn to engage safely with water. And then in terms of the future for women and girls, I would love to have more females empowered to be teaching communities, empowering the communities around them to also be engaging with the water safely, and teaching their children. That would be for me.
Thank you, Kirsty. Nahid?
Yeah, I think inclusion means to include every woman. You know, we have some disabled women in our community, so if we can include them to as a trainer or as a disabled girl to learn swimming, that could be a very good initiative in my perspective. And the other is every child is a gifted child, so we can left any child behind to learn swimming, to teach how to rescue and how to serve others. So these are the 2. Thank you.
Thank you very much. Over to you, Tia. Your thoughts?
Yeah, I think inclusivity is about learning. It's about choosing to listen. And it takes courage and humility to create an environment where everyone is being given the opportunity to be empowered and to contribute their unique perspective to the betterment of the society. In terms of my country, Indonesia, for example, it has a very large population, over 270 million people, divided into over 1,000 recognized ethnic groups, speaking over 7 different languages. So the situation between provinces in Papua and West Timor, for example, will be quite different from the urban, but almost thinking Jakarta, or to Bali, for example, one of the most developed but gentrified provinces of Indonesia. So I think it is vital to recognize what should be appropriate for each of this population by fully engage each of them, including the remote indigenous communities. And in terms of your second question, I think what Nahid has done has been tremendous with her team in Bangladesh in empowering female community members to be trained as lifesavers and also child carers in the ANCAL program. And I think that is very inspiring to be rolled up and scaled up in other countries, including in countries like mine.
Thank you very much, Tia. Mariko?
Absolutely. I think when it comes to inclusion, right, always asking ourselves, who isn't at the table right now, right? Who isn't on this panel? Who isn't in this room, right? Who doesn't have access to the kinds of resources that are being provided? And I think, it's never going to be perfect, but we always have to push ourselves to ask those questions. And I think when it comes to women specifically, thinking about what infrastructure is needed, right, to support women and their engagement in this space sustainably. From an athletics perspective, we can talk about things like sponsorship deals and equal pay and equal media coverage that prevent some really fantastic athletes, right, from getting the sort of credit and recognition that they deserve. That will then help them allow them to continue to be in aquatic sports sustainably, right? And that goes from sort of youth development onwards, and also making sure that we have the most inclusive definition of women possible, right? Making sure that trans and non-binary women and femme folks feel supported and heard in this space, because this is often a very dangerous space for them too. So making sure that even in our definition of women, right, we are leaning towards and calling in that kind of inclusivity.
Thank you very much, Mariko. And Pamela, I'll hand to you for the last word.
Thank you, Stacey. I think, we always say in our organization that the ocean doesn't discriminate, and neither should we. So I think regardless of, whether or not who it is that wants to work in the organization or volunteer for the organization, regardless who they are, what they look like, how they dress, anything, that you shouldn't be discriminated against. They should be included. And in an ideal world, it doesn't really matter whether you're male, you're female, you're gender diverse, what you are. Personal opinions need to be set aside, and remember that all of us are here for exactly the same reason, which is just to make sure that everyone who visits the water today, they go there happy. So you want them to return home tonight happy as well. And that's the only reason that any of us are on this webinar, that any of us do the roles that we do, that any of us volunteer and do what we do. So it really doesn't matter what anything else is underneath all of that. So that's what we all need to be just reminded about. I think a lot of the time that all that other stuff doesn't matter. It's about, saving lives in the water, really.
Thank you, Pamela. I think that's the perfect way to sort of finish the webinar. And hear everyone's thoughts. So I'd just like to say thank you all so much for sharing your experience. The work that you're doing is amazing, and you are all incredible role models for your communities and for the broader drowning prevention world. But I would like to acknowledge all the other women who are playing a role in drowning prevention and in water safety, whether or not that be in a volunteer role, working in the sector, a researcher, but also the males who support us in this work as well. Because I know there's a number of people who are very supportive and, make these things happen as well. And sometimes, we do need that boost every now and then as well. So again, thank you all for attending, for listening and for jumping on. I know, again, some people it's very early in the morning, others it's quite late at night. So we do appreciate it. This will all be available online in the next few days. Please stay safe. Thank you for all your work in the water safety world and drowning prevention. And I wish you a good evening or a good day wherever you are. So thank you all so much for joining us today.